The views and opinions expressed in the following program are those of the participants and do not necessarily reflect those of KSMQ Public Service Media Incorporated or its assigns.
Welcome to On Cue. I'm your host, Eric Olson. Today's show is about significant changes happening in Albert Lea, Austin, and Owatonna. We'll talk about economic development, transportation, and healthcare. Stay tuned for On Cue.
From KSMQ Television in Austin, this is On Cue, connecting interesting issues and interesting people. On Cue.
The Mayo Health System continues to update its facilities and services throughout our region. Today, CEO Dr. Mark Ciota joins us to talk about the Albert Lea and Austin merger. Welcome to the program.
Thank you. Thanks for having me.
And we're coming up, at least in Austin, there's a big, going to be probably a big party come January. The big expansion that everybody's been driving past for the past year is just about to be finished.
Yes.
And is that part of this this merger plan? Was that part of the program?
It was part of the program. Originally, it was designed for Austin and its relationship with Mayo and Albert Lea, but it really is the centerpiece of part of the merger and how we're going to deliver healthcare differently than we currently do.
Okay, and we're calling it Mayo Clinic Health System, Albert Lea and Austin. Will people notice, the patients notice many differences besides the name?
I think initially the answer to that will be no, because a lot of the changes are going to be behind the scenes when we refine our processes, how we see patients, how they get registered. But when we get it right, and we will get it right, I think ultimately the patient will have an experience and they'll know that it's different and that it's better than we currently are doing.
And will, why is this happening now? Was there I assume in your facility there must have been a large amount of study and so on, and why was the decision to go forward with this happening now?
We really want to prepare for healthcare reform that we know is coming, and we think that it's going to change despite the election that's going to occur. And we want to set up the facility and the processes to deliver medical care to the patients of Austin and Albert Lea a little bit differently than we currently do, but we think in the end we'll have better quality, better service at a lower cost. The second reason is that the Mayo model of care for primary care is going to shift from more episodic sickness-based care to population-based care. And so we want to
take a minute and
try to explain that?
Yeah, peel that back a little bit.
Yeah, our current system is set up that you don't access health care until you get sick.
Right.
And so once you get sick, you come to see the healthcare facility, we treat you and send you back on your way, and that's currently how it's been. And we currently get a fee every time we provide a service. And in healthcare reform, it's going to be more about treating you before you even become our patient. How can we keep you healthy and keep you engaged in healthcare so that you don't really get sick, so that you don't really need us in the end for high-cost episodic care?
All right.
And that whole delivery system has to be designed so that we can get it out to all the patients and even people who aren't our patients yet, and design processes so that when they do become ill, they get the care they need exactly when they need it at a lower cost and better quality than we're currently doing it.
And Dr. Ciota, some of the numbers are fascinating about wellness and who pays, who uses health care benefits, and why your new model it might be the real wave of the future when you look at some of these insurance costs.
Yeah, and I think we have a graphic that'll go up on the screen, but what we know right now is that half the population has zero chronic health diseases. So I'll say that again, half the population has no health disease, but they only spend about 5% of the total healthcare dollars. And hospitals and healthcare clinics have never really done anything with those patients because they haven't been sick to see us. But with the new reform, this is where wellness programs and community-wide programs where hospitals will get involved to try to keep those patients from getting chronic health disease.
And look at those numbers when you go up the triangle there.
Right, so if you get one or two chronic health diseases, and that's about 45% of the population, Then, as you can see, 45% of the healthcare dollars are spent by those patients, and that's where our current medical home comes in. Those are the patients that we can really affect their health to try to keep them from moving up into the top of that pyramid, which is where you have multiple health conditions. It's a smaller percent of the population, only 5%, but that's where half the money is spent. So if we can keep the patients from moving up on that pyramid of chronic diseases, we can shift some of the dollars down into wellness programs.
Does it go just as the age goes up? Is that the same escalator there?
Age would be related to that, but some of these diseases are more lifestyle related, genetic related, and certainly age plays a factor in that, but they're not, it's not just simply age.
What are the practical changes? We also have a lot of folks obviously here who work for you. Will they be traveling between the two cities more than they had been, or will certain services go to one facility and not the other, or how's that going to work out?
Yeah, we want to keep, and we will keep, what we call primary care services at each campus, at each location, just as it is, and that's family practice, OB, pediatrics, where your doctor is. Some of the secondary services we would also keep at each campus, so patients don't have to travel. In general, we don't want patients to move back and forth. But a combined Austin and Albert Lea is big enough to attract specialists that we currently can't support by ourselves. And in that case, then, we would probably have the specialist move back and forth between the two sites. And so in that sense, we will probably end up needing more employees than we currently have because we'll attract more physicians with more specialties.
Here's just a hypothetical too. Will me, if I need health care and this merger happened, would I be theoretically be able to get a quicker appointment if I go to Albert Lea? You know, there'll be more physicians or somebody to have a look at me because there are two campuses rather than one?
Right, not only the two campuses, which could help, but you'd have to travel. But the way that the care will be designed, which is a little more team-based, and the new building is actually architecturally designed to deliver care in this manner, is that the way that the hallways are set up, the way the rooms are staffed, the way that people are registered, the way that people are discharged, is all done to increase access to a team of providers for you.
So what does that look like, or what does that mean?
So if you're a patient with, say, diabetes and congestive heart failure, historically you would stay at home until something went wrong. Either your heart failure got out of control or your blood sugars got too high, and then you would come access us. We would fix you up, so to speak, and then send you back home until that happened again. With this team-based care, we will have the ability to contact you in your home, make sure that you're taking your medications, make sure that your weight isn't increasing for congestive heart failures, make sure your sugars are okay, and if they start to get out of control, get you in to see somebody that can help you with that particular problem. Now that doesn't necessarily have to be a physician. It may be a nurse who specializes in diabetes or congestive heart failure who's working with the physician, so that whole team will know who you are.
Okay. Did you look at my file before you came in today?
No,
took a look at me and nailed me.
Don't want to violate any laws. So.
Well, you got me pretty well pegged with your examples there, Doc. Besides the specialists, I know that, well, you hear that it's difficult for physicians. They want to move on. They might not want to stay in one facility, be it Austin or Albert Lea. Will this help attract other types of physicians and keep them here longer, or is that not a problem and I'm just that kind of urban myth about that?
No, access to the primary care physicians is a national problem, and we're not exempt from it in Austin and Albert Lea, but the way this is designed, we think that the rewards of the practice will be such that we'll be able to attract physicians who feel that this is a good way to practice medicine, that they have a good balance of work and lifestyle, and that the patients they're actually seeing or are responsible for are actually getting healthier.
Job losses or attrition, that kind of thing?
No, it's a merger, but not in the corporate sense. The idea is not to put two things together and get rid of any of the employees. In fact, again, if we do it correctly, we'll attract enough new physicians that we'll have to actually increase our number of employees that we have. Now, that's not to say if someone retires or someone wants to move away, would we look at a department and say, is there some services we could share? Sure, we would. But the plan is not to reduce any employees.
And in a lot of cases, I don't know about your business, but in our business, we need the jobs, but maybe the people who are doing them have to learn different skills or move. You know, if it's a computer type job or a technical job, they might have to shift what they were doing, but I don't know if that happens in your business.
It does, and I think that'll be true as we move forward, that there will be plenty of work for all of our employees. Now, it might be a little different work than they're used to, and it might occasionally be at a different campus, but there will be plenty of work.
Mm-hmm. In Albert Lea, they have a wonderful program going on called Blue Zones, and which is kind of a community wellness project. I'm probably getting that a little bit wrong, but
no, that's right.
It incorporates the city and the way things look, and parks, and also wellness initiatives. And is this changeover something that can complement that type of work with the city?
Yes, and I think it's similar to Mauer Refreshed. And I think 5 years ago they would have been separate thoughts, but just like you said, they need to complement. The whole community has to get involved in this type of healthcare, from the healthcare facility itself to different community agencies, the YMCA, other wellness agencies that help the elderly, home health care agencies. And they don't have to be our home health care agencies, but they all has to be coordinated care over this whole spectrum.
A timeline for this merger? What are you thinking?
The actual corporate merger will happen on January 1st, and so we're working diligently on all the legal requirements for that, and then I think we'll see over the first quarter of next year a lot of these clinical changes. The new building opens January 7th in Austin. That's when we'll see our first patients.
Great. Well, thank you. Fascinating. Dr. Mark Ciota, thank you for joining us.
All right, thanks for having me.
All right, come back anytime. We'll be back. More of On Cue coming your way right after this.
You can watch On Cue anytime by visiting the KSMQ TV website, ksmq.org.
Welcome back to On Cue. Lots happening. If you take a drive along I-35, just look and you can see what's going on in Owatonna. Lots of activity, and we're here with an update with Mayor Tom Kuntz. Thank you so much for joining us.
It's my privilege and honor to be able to be part of the show, so thank you.
So every time I drive on I-35, it seems like something new's going in there.
We've been pretty fortunate that back in the 1970s, believe it or not, the City Council made that decision to buy it from the state of Minnesota for about $250,000, and they bought the complex where all our city offices are now, but they also bought the farm that went with it, and that farm then developed into our industrial park that's there now.
Which is wonderful, and for folks, most probably know, but we're coming to you from Riverland Community College in Austin. That's where our KSMQ facilities are, but we do a lot of meetings and so on at Riverland in Owatonna, which is right back in there, and there's plenty of room for growth back there also.
You know, kind of like a triangle. You got Riverland and Austin, you got Riverland and Albert Lea, and you got Riverland and Owatonna, so all three of them play a very important role, and each one does a little bit different function. So,
and as we were talking before we came on, training the next generation of workers, workforce training, is so important, especially so in Owatonna, because as I see it, you have a great mix of manufacturing. You know, so many communities would love to have the kind of manufacturing base you have, and you need a lot of workers going forward that need to adapt and have changing skills.
You know, we were very, very fortunate that we had some entrepreneurs back in the 40s and 50s and 60s, like Buzz Kaplan that started Owatonna Tool Company, Harry Wenger that started Wenger Corporation, and we got Cybex, we've got McQuay, we got just a lot of them. But the one that really brought it to the forefront was Chart Industry. And Chart Industry expanded from into Owatonna because there was a building facility available. And Chart Industry come from New Prague. They still have a presence in New Prague and they have a presence in Owatonna. But they contacted us and wanted to come to Owatonna, but their concern was to find welders. And they needed about 100 welders within a year's time period to be qualified to do high pressure welding and stuff like that. And the training of that was what's really very, very important. They brought in welding equipment machines, and they had 2 training classes every week in order to try and find and facilitate the welders. They've been very, very fortunate, and they're up to about 100 employees right now. So they've been able to find the welder skills and trade them. But along with that, we've got Wenger Corporation and OTC and Viricon and Chart and others that need welders. So Riverland is working with our chamber and trying to start a welding class in Owatonna to give people those skills. But it's not only the skills with welding, it's electricians that run CNC machines. You just don't step into a computerized equipment machine if you don't have some background training for that. So employers are having a harder and harder time finding these qualified people for doing that. So that's why that training is, that Riverland puts on, or Mankato or any place puts on, is so very, very important to give these students the education and the training they need to facilitate these jobs.
Downtown, the centerpiece of it could be the utilities building, and you had some tough sledding in 2009 with the flood and big changes on the horizon for that facility. How's that going?
It is going good. Yeah, back in the 2000s when we had the flood come through, it kind of divided the town. And everybody that I've talked to that's lived there all their life has never seen the water as high as it was. And what it really did was flood the whole lower level of the utilities. So they had to take their offices and relocate them up to the fire department for about a month while they dried the utilities out and got everything restructured. But all the equipment that was in the lower level, which facilitates the generation equipment and the boiler equipment, was flooded, beyond repair. So at that same time, Southern Minnesota Municipal Power Agency is our supplier of electricity. They had this unit number 6 under contract, but they were looking to quit the contract on unit number 6, and when the flood come along, that took care of the contract. So at the end of the year, that was no longer there. So the utilities put together a plan and looked to see what they could recap from FEMA after the flood and all the damage that was done, and really remove and gut the power plant and turn it in more into office complexes and bring everything back under one roof. So the offices and the meter shop and everything will still be there, and there'll be some space available that they would like to maybe commercially or facilitate out. So
some retail possibility?
Retail, commercial. And I always continue to tell them that it'd be a perfect spot for a microbrewery and a rooftop restaurant downtown in the middle of town. So
well, it's a great location for it.
Great location.
Now, if I'm coming, as folks know, you're coming west from Rochester, you take good old Highway 14, cross to Owatonna. How's that construction project going?
As I always give Ardell Brady a little bit of a bad time in Rochester, I say, Ardell, you're losing all the shopper and traffic going to Mankato, because we now have 4-lane highways going from Owatonna all the way to Mankato, but we got this little 18-mile stretch from Owatonna to Dodge Center that's not complete yet. We need your support from Rochester to get that done. So we have been working really hard with MnDOT to try and get that on the 20-year plan. They, at this stage of the game, say they don't even have it on the 20-year plan. So we can't wait 20 more years in order to get that stretch of Highway 14 done. So we continue to push MnDOT and our legislators and the governor to try and find some dollars and complete that section of highway.
But that's a big question mark, I guess, huh?
At this stage of the game, it's a big question mark. Like we say, the MnDOT doesn't have it on their 20-year plan. We continue to try and encourage them to put that on their 20-year plan. I would love to be able to see it in the next 6 to 7 to 8 years, have at least something concrete started on that process. You know, you can't go from 4-lane highways to 2-lane highways back to 4-lane highways and not cause some disruption in travel. And what really happens in southern Minnesota, it's a toll on life, because there's been more accidents on the 2-lane section of 14 than there has been in a lot of places of the state. So,
oh, really?
So it needs to get completed in order to provide that safety aspect.
Oh, it's a safety issue also. I did not know that.
It is. And MnDOT is working on more of congestion and smaller projects rather than bigger projects, and so the safety issue is slid down the ladder a little bit.
Okay. Next 5 years, what big projects, what can folks expect?
Well, I think in the next 5 years, we continue to talk about we'd like to get to 30,000 people. It might not be in the next 5 years. It might be in the next 10, maybe in the next 15. But I think what our main goal is economic development. And economic development, no matter whether it's Owatonna or Austin or Albert Lea or Faribault or Rochester, is good for southern Minnesota. Because no matter which direction you go, you see people commuting back and forth. You know, we have people from Austin that probably come to Owatonna to work. We probably have people from Owatonna that come to Austin, to Rochester. And I think so. We will continue to look to try and find jobs that provide a good income to southern Minnesota.
What about the old hospital location? Isn't that something?
That was we had Alina finally commit to build a new hospital. They stuck about $45 million into the hospital right next to the Owatonna Clinic. And the Owatonna Clinic is the part of the Mayo Health Systems. And they were a little bit nervous when they did that the doctors at the Mayo Clinic would probably shift all the doctors over to Mayo and not to the Alina Hospital. So they had the city get involved in that, and we finally come to an agreement between the parties to provide them access to some loan money. But we were able to facilitate the new hospital, about a $48 million hospital, and the clinic stuck in about another $20 million to expand their clinic. So we have a state-of-the-art clinic and hospital, which left us an old building that was in the middle of town that didn't have a lot of value to it. And we were very fortunate. It sat empty for probably about 4 or 5 years, and we were trying to find some facility to take care of it. And all of a sudden we got contacted by Fairway Foods, which is out of Boone, Iowa, saying that they would like to locate in Owatonna, but they'd like to locate in kind of the center of town. So about a year later, we've got that facility sold to Fairway Foods, and as we speak, they're doing demolition of the old hospital. They hope to have the demolition done during the winter, start construction of a new Fairway food store in the spring.
Wow, new to the area then.
It will be new to the area. I see that they have just purchased Nelson's food store out of Faribault, and they went into that one now. So they'll have a Fairway in Faribault, they'll have one in Owatonna.
Oh, wonderful.
But the nice thing about that is the demolition costs that were at the hospital, we had estimated to be about $1.4 million. And for the city to be able to market that property, it almost had to be tore down. And that was a pretty huge investment to try and tear that down. And with the agreements that we've got with Fairway and everything, they're doing the demo. We've got some dollars that we contributed to that process. They're doing the demo, and we'll construct a new grocery store.
Oh, cost efficient there.
Very, very much so,
Yeah.
Yes, very much so.
All right, and Mayor Tom Kuntz, thank you so much for coming in and joining us, sharing your views here on OnCue. Come back again. Coming up next, our Vision 2020 segment. Don't go away.
Queue up your own comments for On Cue and send them to us at onq@ksmq.org.
And welcome back. Time now for our Vision 2020 segment, and we're going to talk downtown development. Exciting things going on down there, and we're imagining a lot of cool things happening in future years. Stephnee Leathers joins us from the Downtown Destination Committee, and it's kind of easy for me to get all wound up on what could be in a downtown, not remembering that we already have a lot of wonderful facets to the downtown area. So it's, I suppose, a challenge for your organization, your group, is to take what's there and build on it without impacting anything negatively.
Right, right. And I think a big vision for downtown is to really leverage, to your point, the great buildings and the businesses that we already have, as well as just build upon it.
Now, is this, when I talk about downtown, I think of just tourism, but I suppose there are other ways to develop positively a downtown, so you don't just think about getting people to come in and shop or whatever.
Right. So that's a good point. One of the things that we're looking at is the fire site area on Main Street, and developing that, and potentially building a stage, where we can have events downtown and host them in that area. And just different buildings, getting businesses in those buildings.
What about challenge? Have you identified, like, what are our biggest challenges in downtown?
I think the challenges that we've kind of designated are really connecting Fourth Ave with Main Street. You know, there's the Hormel House and the Paramount Theater, and then there's also the fantastic utilities building that they just renovated. And how can we better connect those with Main Street? So that's definitely a challenge.
Ah, so that's a good point.
Yep.
As far as cars, like driving or walking?
Driving, walking, so anyone that's coming to Austin, how do we get them from maybe the Hormel House or the utilities building to downtown? Or if they're downtown, how do we really get them to explore the other areas of downtown?
Oh, okay, because it's a grid.
It is.
The sight lines might not be
right.
as perfect as you would like.
Right. And with the development that will happen probably with the utilities building, we want to ensure that that those people know what's around the corner on Main Street and get them to come down and spend time there. So.
Oh, it's exciting. It would seem that you would have an opportunity to change the look of it.
Definitely, definitely. And that's what we're hoping for too, is to look at opportunities of how can we connect those two visually at some point better as well. So.
Wonderful.
Yep.
Stephnee Leathers, thank you so much for filling us in.
Thank you.
And thank you for your service.
Thank you very much.
In town. And that'll do it for On Cue this week. Till next time, I'm Eric Olson. See you later.
On Cue is a production of KSMQ Television in Austin, nonprofit public television.